This is understanding the atrial rhythms. This will be broken up into a number of different modules as we move forward to make it a little bit easier to assimilate. The rhythms are classified according to the heart structure in which they begin, or their site of origin. Sinoatrial node, or the SA node, fails to generate an impulse. These atrial tissues or internodal pathways may initiate an impulse. These are atrial dysrhythmias. Rhythms generally are not considered life-threatening or lethal. However, we must provide continuous assessment because they could indicate other problems. As a review of the normal conduction system of the heart, electrical impulse originates in the SA node. It travels through the atria via the internodal pathways. The AV node, there is a brief pause. Going through the bundle of His. Then it goes into the right and left bundle branches, the Purkinje fibers, and into the ventricular musculature. Understanding this process is very, very important in identifying rhythms and rhythm abnormalities. Within this, we see that the SA node fires at between 60 to 100 beats per minute. Within the internodal pathways it transfers through. When we get an AV junction originated rhythm, it will begin to slow down at 40 to 60. And this continues to break down until it gets into the Purkinje network, which is part of the ventricles, and it only fires at 20 to 40 beats per minute. Let's look at wandering atrial pacemaker. WAP, or wandering atrial pacemakers, occur when the pacemaker sites wander or travel from the SA node to other pacemaker sites in the atria, the internodal pathways, or the AV node. The SA node, however, does remain the basic pacemaker for the heart, so it can indeed fire as well. Observation of at least 3 different P waves are required. The size and shape of the P waves vary according to the site of origin. The P waves may appear upright, inverted, or absent. The absence of P waves may indicate P waves that are buried within the QRS complex. The PR interval may be regular or may vary based upon the point of origin. So the PR interval could be just a little bit longer, or it could be just a little bit shorter. Wandering atrial pacemaker, or WAP, produces no symptoms and is only recognized by EKG observation. WAP, for the most part, is also going to be a regular type of rhythm. So as we break it down here, we see what is the rate. Generally, it's going to be within a normal range of 60 to 100 beats per minute. The rhythm. It may be slightly irregular, or it could be completely regular. Looking at the P waves, do we see P waves before each QRS, and are the P waves upright and uniform? Well, basically with the P waves, because they're coming from different spots in the atria, we're going to see different shapes, different sizes for multiple types of P waves. The length of the PR interval could vary, could be normal, could be a little bit longer, could be a little shorter. And generally we have a normal upright QRS that is not going to look bizarre. So as we look at this one, let's kind of break through it there. We can see that our rate is about 60. The rhythm is regular. There are P waves. They are present and upright. However, we see P waves that look different. This one looks like a regular foreign P wave. This one looks very similar to it. This one begins to flatten out a bit. This one we see just a tiny notch in here, and this one gets even smaller, as does this one as well. The QRS itself is about 0.0 or 0.08 seconds, and it is normal and upright. As a result, this would be wandering atrial pacemaker. So let's take a look at multifocal atrial tachycardia, also known as MAT. This is a variant of the wandering atrial pacemaker. It occurs when the rate reaches 100 beats per minute or greater. Now, this could be confused with atrial fibrillation that we'll talk more about in just a little bit. In these patients, we see this in patients that have advanced COPD, digitalis toxicity, and several different types of electrolyte imbalances. So let's take a look at this rhythm. Okay, the heart rate is approximately 120, so it's greater than 100. So we know it's going to be a tachycardia. The rhythm is irregular. Now keep in mind that the rhythm is irregular primarily because the stimulating site is coming from different places within the heart. There are P waves. They're upright and rounded for the most part, but they do look a little bizarre. So this one kind of looks peaked. This one is even taller than that one. This is smaller. This one is kind of bifurcated, so we see that it's kind of up and down there. This is smaller. If we get a little bit larger, we have another bifurcated one there. So we see that it is different. As a result of it coming from different sites in the atria, your PR interval is going to be variable. The QRS complex, as we look here, is about 0.04 seconds. It's normal and upright, and it does not look bizarre. So this is part one of the atrial tachycardias that we're going to be learning.